They took 4 years of medical school, condensed it, crammed it into 2 years, and then we're PAs, we're out practicing. You go straight into practice. That's the best profession I could have ever wanted to go into. The first year is extremely difficult. It's the same instructors as the med students, the same information. It's a rough program. The first year of PA school is all didactic. It's all book work. This is where you learn the fundamentals of medicine, and then as the year progresses, they start focusing more on the physical medicine to prepare us for our second year. We have to know exactly how to look in someone's ear, to see an eardrum, to look in someone's throat, and to see what's there. You really can't learn a lot of this in a book. We practice on each other in the first year, doing exam, listening to heart sounds, listening to the lungs, and giving IVs. So for the first year, we had a lot of hands-on. The second year is where we go out into the field, we go in and we see the patients, and we come up with a diagnosis and a plan, and we present the case to the preceptor, who is either a physician or a physician assistant, and they tell us if we're right or wrong. Very, very dedicated. And dedicated, loyal to the students. They were practicing PAs, and they told us like it was. They really prepared us for practicing out in the real world. They're amazing. There's one particular faculty member that comes to mind that I will never forget, and he really connected with the students. When we first started, he really was hard on us, and then he says, it's not going to change. He said, we have to be this rough on you because you're going to be dealing with people's lives. So we're going to continue. I'm going to continue to be as hard as I can. The papers that you write for me, there's a reason for it. And once we got an understanding why he was doing this to us, he became our favorite instructor. Each student is assigned a mentor, and that's somebody to talk to about anything. My mentor was the medical director. He did his best to develop a good relationship, not necessarily just the student and teacher. They connected with us on a more personal level too. But always keeping the profession in mind. We were never allowed to call them by their first name. It was always Mr. Moreau, Dr. Meyer. I still call him Dr. Meyer. We would go out and the PA students would celebrate, like we had passed the big exam or something, or gotten through a good quarter, and we wanted to go have a couple drinks, and some of the teachers would join us. So they still maintain that air of professionalism with a touch of personalism. There has to be a team approach to medicine. And you can see that best in a hospital setting, the team approach to medicine. Our very first year, we are training side by side with the medical students. Some of the classes are with the farm students. We all go through some of the same training together so that we know how each one interacts. And it teaches the student at the student level what the other's purpose in medicine is. There are clubs within the school. I belong to the ER club, and that gave us a chance to do more IVs, more suturing practice, learn more suturing techniques. In the EM club, they also had ride-alongs with fire departments, ride-alongs with medevac. There's also from what I remember, a pediatric club. There's a family practice club, and there's all kinds of clubs that you can join to learn more about a certain specialty that you want to go into. There'd be a pickup game of basketball. We have a nice basketball court out there, and that's how some of the students decompressed and got some exercise. Hiking clubs, and they made it well aware amongst the students that we should go out and do something, because you don't want to just study all the time. You go crazy. So to sum it up in one word, it would be challenging, extremely challenging, but well worth it. Would I do this again? Absolutely. Being a PA is exactly what I want to go through. It's the best thing I have ever done for myself.